Happy New Year. It's 2022. I can't believe it. And this is our roundtable, first one of the year. Yay! So we're all here, and so the topic seems like a little bit of a paradox. New Year's resolutions, get ready for summer. Like we're getting ready for summer in January. But these are things that we really wanted to talk about because these are the times that you have to pull that trigger. So first of all, I want to mention to everybody, we all know that we have New Year's resolutions, and they usually involve diet and exercise. We all seem to want to go into that realm, but you know, others might have health. Whoops, that was a loud one. Health, relationship, career goals. I'm going to turn this volume off so that nothing can keep coming in here. There we go. Sorry about that. And of course, all the things that we do here that take a little bit of time, like skin rejuvenation and some of the other topics that we're going to talk about. So we're kind of going to mix and match and get a little influence, and I'll try to lead you around the circle like I usually do. So first of all, I want to introduce everyone in case you don't know us. I have Ronnie to my right, your left. This is Derek, and this is, who are you? This is Marley. I'm just teasing. She was ready to talk. And this is Lori. Lori's new to us this year, so you'll be seeing her more and more. And of course, then we have Suzanne, and I'll let each of them tell you what they do for us and what they do for you. So I think I want to start this discussion with health, because we are a medical facility, and I think that's the most premier New Year's resolution that I would like to promote to anybody that's listening and anybody that we care about. So I recommend that everybody make it their effort to focus on their health this year. Go and get a doctor's appointment, get a checkup, because I'm sure through COVID, people have been lacking that. I mean, everybody is, I know, trying to work on getting their COVID tests and making sure that they're COVID free and that type of thing, but you may have been neglecting, you know, moles, cardiac exams, eye exams, all those different things that preventive,
like mammograms, colonoscopies,
right?
Lots of those things.
So I think that that's foremost. We can do a little bit of that for you, but not all of it. So on that note, since
exercise and diet.
Exercise and
internal
diet.
health shines through for sure with
Yes.
your skin health, hair health, everything.
Yes, and some of the treatments that we're going to talk about today coincide with diet and exercise, and we hate those two words, and they kind of go hand in hand, and I know that we all struggle, as I had my chocolate caramel for lunch. So that was a no-no, because I too have that New Year's resolution, eat more healthfully, exercise, right? Oh, that was my moderate, like, dessert for the day, just eat that little piece of chocolate. It was that dark chocolate with the salt. Yeah, it was good. So because we're going to start off with that diet and exercise thing, I wanted to turn this over to Marley for a hot second, because one of the things that we do here, we do vitamin drip, and so that's one of the things that you could maybe add to your arsenal if you'd like. So Marley, I'm going to kick it over to you.
Yeah, because we're all trying to eat healthy, you know, get all of our vitamins and nutrients so that we have healthy looking skin, so that our bodies are healthy, our hair's healthy. So we do offer vitamin drips here. You would have an appointment with me. We offer several different formulations, and they're particularly good for people who do have a poor diet. So if you're just somebody who does not like to eat your fruits and veggies, this might be something that you can do to kind of, it's a little stick in your arm, so it would be an IV of hydration and vitamins and minerals. And also it's good for people too who have stomach issues. So if you have a lot of GI issues, sometimes people aren't absorbing all the nutrients that they need. So by doing it IV, we're bypassing the stomach and that absorption, that route, so that way you are getting everything that you need. So
That's good. I love the vitamin drips. I know many of us here have had them before, so they are good. They take a little bit of time, so you have to put that into your schedule. And there are discounts on getting, so that if you were to stage this, and have a series of 3 or 4, I'm not quite sure how Marley has it.
Yeah, I have there's packages you can do. I mean, we don't recommend more than once a month is sufficient.
And that's
And there's
great.
different types, right?
Yeah, there's an energy, cosmetic, and recovery we offer. So
That's great. And I know that sometimes when, after New Year's Eve, people might have wanted to come in for a vitamin.
Yeah.
There is
I've used it for that reason. It works like a charm.
It's named recovery for a reason, yes.
It does work for a hangover, I will say.
Yes.
I've used it.
yeah, so not a substitute for trying to eat healthy and stay hydrated, but a good addition.
So that's our one service that we can provide, going into that health part. And obviously seeing Dr. Collini if you have moles or lesions or issues that
Yeah.
require surgery.
One of the things too is a lot of people don't realize we offer this. We can do a skin check. So if you're a person who has fair skin like myself, if you have lots of freckles, moles, marks all over you, you can come in and if you can just have us examine you full body and just make sure that everything looks okay. And if we see something that looks suspicious, then we'll suggest you have it removed. So that's always an option.
Right. That's good. That's a good maintenance for our medical part of the woods, so to speak. So now that we've got that out of the way, now we're going to head into the cosmetic realm. And I'm going to start, since we're talking with Marley, we're going to go right into Quo. And you've been hearing about Quo, I think, our last 2 roundtables we've mentioned Quo. So I'll let you give a little tidbit about this because it does take a little time to get the results. That's why this is part of today's roundtable again.
So Quo is the first FDA-approved injectable for cellulite of the buttocks, and we can also treat the thighs. So now is a great time to treat cellulite. I mean, nobody's seeing your cellulite because you have pants on, it's winter, it's cold. But with the treatment of Quo, the side effect is that you do have some bruising. So, it's not something that you really want to do in the summer because you're going to have shorts on, skirts on. So now's the time to get this treatment done so that way when summer comes, you don't have any cellulite, you don't have any bruising, and your butt and thighs are smooth and cellulite free.
Sounds good to me. Sign me up.
Yeah.
So that is one of the things that we're going to do for the winter. And one of the next things that we're going to consider for the winter, I'm going to work with Lori and Suzanne because their treatments go simultaneously because we're talking about hair removal. So I'm going to leave it up to Lori. Go ahead, Lori.
Okay, so it's a good time to start that because usually you need about 6 treatments or so to reduce the hair and get rid of it. I don't know.
So that those treatments can be spaced. How long are they spaced apart?
Usually about 6 weeks apart.
So you can see that it takes a while. And remember that hair removal laser is a treatment, it's not a cure. So it's something that is ongoing, but we want to get the majority of those treatments in the winter time before the summer hits, because you really can't do lasers.
Well, yeah, you want to be hairless for the summer.
Right.
But you also, if you have any kind of, our particular laser goes after melanin. So if you want to not have, you can't have laser treatment if you get any kind of tan anywhere.
Or self
Yeah, we could do other areas that might not see the sun. But other than that, you
Right.
really should put it off.
So
You
this
should
is
get
one
that
of
done in
those
the winter
things
time for sure.
that if you have goals,
Right, if you're thinking about your bikini season coming,
legs, arms,
legs,
that
arms,
stuff,
bikini
face,
area,
right?
Face,
yep.
yeah.
Face, any of that
Face, yeah.
stuff, this is the time to get on board, give us a call and get us, let us get you started because it does take a while. And thank goodness, our appointments are booking up.
And now we have Lori, thank
I
God.
know.
Lori
Lori
can
is
see
a
lots
great
of
addition.
patients.
Great. Because
She's ready to take clients
Yes,
and,
I am.
yeah.
yes, she is. So that being said, we're gonna go right into Suzanne,
Sure.
because she is also working, if you don't know, she's our electrolysis technician, and she's gonna talk about pairing electrolysis with laser hair removal.
So there's a huge freedom that you get from never having to, shave your legs again or shave your armpits. You can just throw on a dress and not even think about it. So we definitely recommend the laser for any treatment of body hair, armpits, bikini, legs, arms, things like that. Where electrolysis is great is for the face. And I hear so many of my clients say, I've been struggling with this for years and I just didn't know what to do, or I didn't really know that there was a cure, not a cure, but something I could actually do about, chin hair. I'm just used to plucking, 20 hairs every morning. I just thought that was my life. And so I would say, especially for a New Year's resolution, to start this process now, because it is a process and it takes some time, but there is a real solution and you don't need to live with that for the rest of your life. And it's really incredibly freeing once you start the process, and then when you get to the end result where you don't even have to worry about it anymore. It's kind of amazing. So where we go hand in hand with the laser is, you need, like Derek said, melanin or color to attract the laser. So even if you're doing, hair removal on your legs, but you have some spots where it's lighter or gray, we can work together to make sure you're totally hairless. And then I do anything on the face, and it could be any color hair from dark to gray, blonde, doesn't even matter. So it's, if you've been pushing it off or just think, that there wasn't any other option, there absolutely is, and now's the time, especially when you're not out in the sun, now's the time to start.
Thanks, Suzanne.
You're welcome.
So, all right, we're removing hair. Now we're gonna go to growing hair. So now I'm gonna turn this over to Ronnie. Actually, Ronnie and Marley might tag team on this, but I'm gonna let Ronnie start with hair growth.
Yeah, of course. So, away from taking the hair away, growing the hair, something we do here at the center is PRP, which is platelet-rich plasma injections. Marley and I have really gotten on a good track of doing them. So, PRP is a treatment we do with the scalp. It's an injection. We take your blood, we spin it down, we harvest the plasma from it, and we inject it back into your scalp. And what that's going to do is it's going to give a lot of growth factors to your hair and help your hair grow. So, Marley, do you have anything to say on?
If we start talking then about the supplements, like
Yeah.
how,
Bring it up.
and also, so we have Nutrafol,
Yes, so
which
that's a new
is
product.
a new product that we have for hair growth. It's a supplement. I don't know if you want to talk more about it. You're kind of the expert.
Yeah, so we just, we had Viviscal in the past, and Nutrafol is our new product that is, it's a supplement that's really geared towards hair growth, specifically male and female. There's different formulations, even postmenopausal women. So,
He looked at me. He looked at me. You saw that, didn't you? He looked right back at me.
Blackboard, if you look for support. But anyway, so the Nutrafol is a new product we have here, and it's going to help balance your stress, balance your cortisol levels, and hopefully any of those factors that are really detrimental to your hair growth, it's going to get rid of them and just let your body grow your hair naturally. But on top of that, we do the PRP injections, which is going to even furthermore help that hair grow, stop any loss that you have, and
Which I personally had.
Yeah.
Yeah,
And I
and-
absolutely love it.
Nutrafol, the nice thing about this product too is that it's very natural. There's no contraindications to taking it with any other medication or supplement that you're currently taking. So that's nice.
And
you
it's
know,
not a
it's-
medication
it's-
either, right?
Right. So, but a lot of times there's like
Minoxidil
contraindications
or-
to
yeah.
certain even supplements, like don't take if you're on this medication
Okay.
or that medication. But there's nothing with this there's no contraindications to taking it. And then another good point about just eating healthy, being healthy, taking this supplement is when we do the PRP. It's your own blood, so the healthier your blood
Yes.
is, you're taking this supplement with all these vitamins, nutrients, all this good stuff for your hair. If you're taking that, then that just makes, if you get the PRP injections, that much better, because all that good stuff's in your plasma that then we're injecting directly into your scalp. So,
So the one thing I want to say about the Nutrafol, because it is new to our center, And that's just a reminder that we're always looking to improve everything that we provide for our patients and of course ourselves, because that's the nature of where we how this all started in the beginning with all of us. But Nutrafol also is, you can get that on its own. It doesn't require having to do the PRP or the stem cells. You can just do that as a supplement for your health. So you can purchase that and just come in and get that from us as well.
Yeah, and that's a 3-month supply that we sell. So, they say it's going to take about 6 months until you're really noticing those results. So definitely, you're buying the 3-month supply, get that one through, get the next one started. So it's a good time this first of the year.
Yeah. So that's what this discussion is about. Is that all these treatments and services? Remember, cell renewal, cell regeneration requires. There's no more. God. There's one right over there. There you go. We've all suffered a little cold. We've all tested for COVID. We're like all good.
Many
Knock on wood every day.
But I know is one more time.
So the winter colds are still there with us. So I'm sure that all of you are feeling that as well. But to get back to all these different cell renewal takes time, and all these treatments are turning over cells, and that's why you have to think about results for summer. Actually doing that now. So that's what everything is doing.
I like to that just everything we do here you can do in stages. Like if you're somebody who just has a little bit of hair thinning, just it's something that's concerning to you, but you're like, I don't want injections or anything crazy. Like you can just start with a supplement, and then after the supplement there's the topical serum that Nutrafol offers. So then you can add that. And then if you still want something more, then there's the injections, and then all the way then to hair transplant. Like, so I just think we offer so many things, different levels of things.
Right, there are different levels
And
of
we can help
treatment,
you figure
different levels of investment, because we all have to think about everybody's pocketbook. That's something that we try to work on all the time. So there is a different way to attack it. And one thing I've always told patients, we have the Rolls Royce version, the Cadillac version, and the motorcycle version. Or the Volkswagen, whatever any of them are. So there are different things for treatments, but you just have to remember the expected outcome. It depends on some of those factors that we based on your choices. So I think that's a good thing.
Yeah, because we can help you figure out where you need to be and where you want to be and where you can afford to be at that time.
Right.
And again, with the PRP, that's something that's going to take a little bit of time. So it's it's 3 treatments, and you need 3 weeks in between those. So it's about 3 months you're looking at before you're done with that series.
Yeah, and the one thing that PRP is good to do in the winter now too is because we don't want you wearing a hat. We don't want you
Sun exposure.
Saunas. Or
pools.
Getting it wet. Yeah, like for the first couple of days after, because we want all that PRP to just stay where we put it and soak in and absorb. We don't want anything to mess with where we put it.
That's right. So if you need your ears covered when you're outside, they have those little ear muffs that you just clip onto your ear. Right? So I've saved the biggest topic for last. Because I wanted to be able to give everybody an opportunity to speak on the different the other services that we provide. But laser is the biggest thing that we really do in the winter time, because facial skin rejuvenation or any of the fat reduction lasers that we have, all those things take time for results, and that's why this is an important topic for now. The one thing that I really want to mention, I'm going to let Derek talk a little bit more about it, but we just added a new laser to our wheelhouse. And we will be talking more about this particular laser next month. So we'll just hit you on the highlights, and you can do a little research on your own and look it up and what it does. But I'm going to turn this over to Derek.
So we got the Morpheus 8.
Ooh.
So we'll start off with that. That's a good place to lead into it, saying that things are done in stages, because a lot of the new lasers have really changed their technologies. And what they're finding is if they do less is more at this point. So what they've done, instead of using like a single beam in a laser, there's many little beams that come out and leave some healthy tissue in between. So what that equates to is you having to do a couple of more treatments, but you're gonna have a lot less downtime, and they more want your body to react with its own biology to build collagen by being stimulated gently. So we don't want to just jump in. They used to just kind of peel
Take your
your
face
face
off.
off with the old lasers, and people will say to me, well, why do I have to keep coming back? And you know, it's actually healthier and it's better for your skin, and your results do tend to be better doing, you know, 4 to 6 treatments instead of just doing one really, really heavy treatment. But when we're reversing sun damage, and most of the damage on your skin, up to 70% of it, really is from the sun. So, you know, dynamic wrinkles, pigmentations, red veins and vessels through the face. This is all pretty much caused from your sun exposure. So we're obviously not going to treat you in the dead of summer when we know that you're outside. It's completely unavoidable. Even if you have sunscreen on, the sun's just too powerful. So all of these treatments, building collagen, resurfacing, those are IPLs, your CO2 lasers, fractional lasers. You want to start all of that stuff right in the fall. So as soon as your skin has faded to a lighter color, we will start at that time. I'll get you on a good product that kind of fades that summer pigmentation, and then we'll start at a baseline with laser to get you where you need to be. Obviously, you're going to protect your skin throughout the summer, and there are treatments that you can do like hydrofacials, and there are certain very, very light chemical peels that you can do in the summer to fight acne and pores and things like that. But mainly you're going to start in the winter time with all of your treatment for resurfacing and also body treatments. So I do a lot of cool sculpting, and I have people come in and they start their treatment and they say, all right, well, when am I going to see the results? And I say 90 days. And they started in June, so their summer's gone and they haven't seen their results. So I do always urge people, and we're always here to educate, but I do urge people to educate themselves a little before they're seeking these things out, so they're not disappointed if they do come see us and it's something that may be a 90-day, you know, down the road result, which is the same thing with us doing those lighter fractionated laser treatments. This is done in stages, so sometimes you'll do your last treatment, your third treatment, and you'll still build collagen for 6 months after your last treatment. So the last thing we want you to do is degrade that collagen by going out in the sun and being at the beach. It only takes a full day of exposure to bring back pigmentations. So I've done it full face IPL on someone, all their brown spots are gone, and they go in the sun, they come right back. Because what we're doing is we're basically treating the symptoms of damaged cells. So when you have melanocytes that create a brown spot on the face, those are damaged always. So whenever you go in the sun, they come back out. So we use lasers to eliminate that, but you also have to do your due diligence to not get the exposure to bring them back, because those cells are permanently damaged in your skin. So we'll use, you know, we have great medical brightening products. We have melanin inhibitors in our vitamin C products. Susan and Doctor have their own medical grade line of cosmeceuticals, and all of that pairs really well with our procedures in this office. I don't know, I mean, I don't want to branch into every kind of laser. I could, and also,
Oh, you could.
I could talk,
There are now
I could talk
18
all
of
day about lasers.
There are 18 lasers now in
There
our arsenal.
are many.
Yes.
So, one of the things too, tattoo removal. So you definitely want to do your tattoo removal in the winter time, in the colder months. There's about 2 or 3 months that you really shouldn't be treating. Number one, you're probably more likely to go in a pool. You're more likely to be in a public setting like that, or go in a lake, or do something that may cause you an infection. So you have to be really, really diligent and careful with laser tattoo removal, because it does cause some exposed skin. And it goes after coloration. So one thing that people can cause themselves when they get heavy sun, when they're in the middle of doing tattoo removal, is something called ghosting. So what's going to happen is, and it's not our fault, it's just something that happens to the melanocytes. You'll damage that area of melanocytes from having that transition of melanin, and you can cause a white scar of that tattoo. So you really want to avoid any kind of treatments like that in the dead of summer as well. So I always urge people, as soon as you're done with all your vacations and it's fall, that's when we start doing our radio frequency microneedling for tightening. We start doing our CO2s for, you know, resurfacing and remodeling finite parts of the skin. You can do your microneedling again, because that's again something that's very important for you to not be exposed to pools and lakes, and that's the most common thing that I find, even worse than the sun, is they want to go jump in the pool, and I'm like, it's not a good time for that, you know. And people don't want to restrict their summer completely hiding in from the sun. I get it, we all do like a little bit of warm sun on us, but it's still
I'm
not
always
good.
covered.
But yeah, that's definitely when I would start, because most of our treatments are anywhere, you know, microneedling, you could do like a three to 6 session. So they're all a multi-session, about 4 to 6 weeks apart from each other. So you're looking at a little bit of a haul here, and you want to make sure you have enough cold season for you to do it, because as you can see, we barely get any sun around here anyway.
Oh, that's depressing.
It is.
No, that's great. I mean, the lasers are just amazing, and we're so excited about the new one that we offer. Again, trying to always stay on the cutting edge of what is new and what we can provide for you, I think is
And
great.
speaking of health, we're getting into women's health.
Yes.
We have the new Votiva, so we're going to start getting into some vaginal rejuvenation, which can be treated internally and externally as well. But we'll get more into that once we start talking about the Morpheus. We're really
That's
excited
right.
about it.
That's part of the Morpheus system. That's gonna be really exclusive next month. We'll get really involved in it. We will be starting our treatments for Morpheus after January 17th, when the machine is totally put together and all that good stuff. So if you are interested, I gotta back up just a minute. I think that sometimes people come in and they have a certain procedure that they want, or they think that that's what they want. And most times we can provide that if that's what someone wants, but sometimes you just might not know what you need.
Yes.
You might want it, but you might not need it. So that's where we professionals can really help you in deciding how to go forward, because the real specialty of all of us is that we can custom your treatments. So you don't necessarily have to have 3 to 6 treatments of the one laser, that the one practice only has one laser. So we have so many options that we can
You do a lot of
really
combination
specific
therapy.
combination therapy, and specifically for you, which will get the best of it, like the 1540 in combination with the
With
Tetra,
IPL.
with the Morpheus. I mean, 3 different types of target lasers that help resurface, rejuvenate, and that type of thing. I just think it's awesome, and I'm really excited that we have this great team and that we can bring them to you. And now we have Lori on board, so we have a newbie that you'll be able to see monthly as well. And look forward to the things that we have decided to do social media wise. One of the hardest things for us to do is constantly present material before and after pictures, little information on our social media. We really do our best, but honestly, we're really taking care of you, and we're doing treatments. So one of our new goals for the new year is to make sure that we can present material to you on our Age of Innocence Facebook page, our Renaissance Center Facebook page. So please look that up. Stay in tune with us. Learn everything that we learn, things that are reminders. We love to share. It's just who we are. And on that note, does anybody else have anything else to add before we say?
Use your
Andrew?
skincare and wear your sunscreen.
Right, at the very minimum, you know, and I know some of these treatments are very, very, you know, they're not always affordable for everyone, but good skincare is.
Sometimes
Yeah.
a good cleanser makes all the difference in someone's skin, and a simple moisturizer, and that's all they need.
That's right.
In the professional products, it is different. They are different. They are, they're regulated. And when you're using products from the store, there are some good ones. You know, there's Olay thing. There's some products that will make your skin look nice, but you're going to see a huge difference when you use one of our professional products or a professional product in general. they're just geared a lot more towards, you know, a serious patient that wants active ingredients, and they have the active ingredients in them.
Right. Thanks for that plug. I wasn't expecting that. So on that note, stay tuned with us in February when we bring you everything about the Morpheus 8 and our women's health. We're going to introduce all that next month, just before our Valentine's Day. So remember, we're supposed to, you know, start thinking now if you want anything really special before
I
Valentine's Day.
know what all your wives want for Valentine's Day.
Right. On that note, thank you everybody for tuning in, and thanks for my team for sharing all your information, and we look forward to seeing you in February. Bye everybody. Happy New Year.